Good morning, children. Last day we are discussing about role of government in health. That we defined what is health, and we see what are the positive and negative aspects of Indian healthcare. And today we are going to discuss about public and private healthcare system. Private healthcare system. And before that is two stories given in your textbook that you have to read and understand. First one is about Hakim Sheikh, and he was a member of Paschima Bengal, and he was also a famous man because he was a member of an agriculture labor organization. And in 1992 he met an accident, and he was seriously injured, and he was taken to Paschim Bengal government hospital, and there is no bed is not available. So again he was taken to other hospitals. Like that, many hospitals, he was taken to many hospitals because proper treatment is not getting in the government hospitals. Around 14 hours he was seriously injured, and in a critical stage he was spent in different hospitals. And at last he was admitted in private hospital and take a treatment. After taking a treatment, he filed a case in the court because the government healthcare system is not provided good treatment there. That is about Hakim Sheikh. And another one story is given, that is about Aman and Ranjan. In that, Ranjan was a poor boy and Aman was rich and is rich, and they were thick friends. And in the vacation time they got a viral fever, and both they admitted in different hospital, and they are saying uh, the experience in different hospital. And Ranjan was poor and he was admitted in government hospital, and he was taking treatment there, and only less money is charged in government hospitals. But Aman was taken into private hospital, that is like a five-star centralized AC, and separate room is already available, and in that room TV and all kinds of things are available. And many times doctors are checking, and many medicines are given in private. In government hospital only few medicines only given to Ranjan, but for Aman many medicines is given. Like that, lot of money is charged for that one, 3 days. So that is about different experience in public and private hospitals. Now we are going, so you have to read that stories and you have to understand. Okay, then healthcare India is divided into public and private health. Okay, public health service and private health centers also. Okay, and public health service is a chain of health centers, and hospitals are run by the government. Okay, so public healthcare system is a chain of health centers and hospitals run by the government. Okay, and they are both are linked, and together, so that they cover both rural and urban areas, and provide good health care system and good treatment for all the people of India. Okay, that is about the public healthcare system. At the village level, there are health centers. Okay, in the village level, if you check in your village, there will be one health center will be there. Okay, if you take a district, it can be divided into three. First one is that health centers. In your village there is one health center, and there is maybe only one nurse and one helper only will be there, and they are trained to common illness, and they are reporting and checking in that areas common illness and spreader diseases are going on. All these things are checking. That is about health centers. And second one is that these health centers is controlled by PHC, primary health center. Okay, there will be some doctors and many nurses are there, and some kinds of treatment materials also there is, and they are controlling these health centers. and all these things. It is known as PHC, okay, primary health centers. And the district, another very important hospital, that is district hospital. Okay, next one is that district hospital, Wayanad district hospital, that is in our Manandawadi, is a Wayanad district hospital. They are controlling all these PHCs and health centers, and like that this government system is going on. So this system, public health care system, linked both urban areas and rural areas, all these covering all these urban areas and rural areas, and so they are controlling this common illness and providing quality health for all the citizens. That is a main aim of these centers. Okay, and in the towns there will be medical colleges also. There is our medical college is going to nearby Kozhikode. Okay, so like that government healthcare system is going on. The healthcare survey is called public for many reasons. Okay, why it is called public? That is now I am explaining. It provides quality healthcare service either free or at low cost, so that even poor can also take the treatment. So what is why it is called public healthcare system? Because it provides quality healthcare service either free or at low cost. Okay, so it provides quality healthcare service either free or at low cost. So that is why it is called, one main reason. And so the poor also can be take the treatments. Then second one is that it takes action to prevent the spread disease. Okay, spread diseases. So it takes action to prevent the spread diseases. So that is example, malaria, tuberculosis, all these things are, jaundice is there. Now the corona is going on, COVID is going on, when the Nipah is gone. So like these spread diseases, preventing these spread diseases and controlling and take the action against these spread diseases. That is second main reason why it is called public health. Okay, so it is for the public, for all. Then the time to time it takes up campaignings against these spread diseases. Okay, like this when the rain is coming, and they are giving campaigns, awareness programs, and mosquitoes, about mosquitoes, and how can be the mosquitoes, how spreaded the diseases, and all these things, who is explaining, giving campaigning against these diseases for controlling. Then the system is available both rural and urban area. For this reason it is called a public healthcare system. So first one is the main reason, at the low cost it is getting to all, provide quality healthcare system at the low cost. Then take the action against spread diseases, and time to time giving campaigns against spread diseases, and this system is available to both rural and urban areas. So that is about our public healthcare system. Okay, so you have to read now textbook, and some questions I will give, that also you have to read. Today I taken healthcare in India, public and private. In that public healthcare system I taken, and it is a chain of health centers and hospitals run by the government, and it is linked together. So it is cover both urban and rural areas. In village level 3 system is there, that is one is health centers, and another one is PHC, primary health centers, and another one is district hospitals, and taluk level also hospitals is there. Like that, chain of hospitals. Okay, chain of many hospitals, health centers, and primary health center, taluk hospital, and again district hospital. So all these things, both urban and rural areas covered, and finding out the problems faced by the poor and needy, and controlling spread diseases, so that it is called public health in India. This is our public health system, and it is going very well. So I will give the questions, and you can do the activity. Okay, thank you.